So today we are going to talk about breast implant illness. Breast implant illness was a term that was created in 2014 to describe a constellation of symptoms that patients actually have been describing since 1981. In 2014, the phraseology of breast implant illness was associated with these symptoms. The most 10 common symptoms are fatigue and weakness, headache, tingling, joint pain, muscle pain, loss of hair, GI disturbance, weight gain or weight loss. Breast implant illness can happen whether you use silicone implants or saline implants. So it's associated with both implant types that we have. And from those who have breast implant illness, 60% have been found to have silicone implants versus 40% who have saline implants. It's important to note that breast implant illness is a self-described diagnosis. That means that there is no way to actually diagnose whether a patient has headache or tingling or muscle pain or joint pain in relationship to their implants. And breast implant illness doesn't happen in everyone, but we do recognize it and we do understand and appreciate that in a selected number of people, breast implants probably are the causative agent of breast implant illness. In my practice, when a patient presents with breast implant illness, I typically notate their symptoms, try to come up with a plan together with the patient. Recently, American Society of Plastic Surgeons and International Society of Plastic Surgeons, where I'm a member of, has sent plastic surgeons patient safety guidelines regarding taking care of patients with breast implant illness. In 4 recent studies from Australia, Netherlands, and 2 from United States, it has been shown that once you remove the implant from the patient, and again, I want to underscore this, once you remove the implant only, the majority of patients actually have improved symptoms. These 4 studies have also shown that there is no correlation between improved symptoms and whether part of the capsule or all of the capsule is removed. Again, the capsule is the scar tissue, the envelope that the body produces in relation to the implant. And it's the way that the body is segregating the implant from the rest of you. And it happens in everyone. When the capsule becomes thickened and scarred up, i.e. capsular contracture, we know that we need to go and remove the capsule. Capsular contracture does not happen in every breast implant illness patient. So for those who have a normal capsule, the question is whether we need to remove the capsule or not. And the data from these 4 papers again indicates that you do not have to, and there is no benefit to the patient. Anyone who has breast implant illness for sure should have breast implant removal. And whether they have additional capsulectomy is a decision that has to be made between the surgeon and the patient. So in my practice, my job is to educate my patients. It's not to tell them you need to have your breast implant removed and you need to have your capsule removed with it. I'm here to tell them that if you have breast implant illness and if we remove the implant, the data shows that you get improvement of your symptoms. And again, I have to underscore and educate my patients and say to them that 4 recent studies have shown that whether you remove the capsule or not, you may not have increased improvement in your symptoms. So with that said, once the pros and cons of each surgery is discussed, then together with the patient, we can determine whether just implant removal is enough or whether we have to remove the implant with all of the capsule.